Now we'll discuss how the ABCDs apply to children. Child CPR is used for victims from age 1 until puberty. Cardiac arrest in a child usually occurs as a result of respiratory arrest. Some common causes of respiratory arrest in children include drowning, traumatic injury, choking, respiratory illness such as asthma or pneumonia, and poisoning. Because the cause of cardiac arrest in children is usually related to breathing, it's possible to restore normal circulation without the use of an AED. There are some minor differences between adult and child CPR. If you're alone, perform 2 minutes of CPR before leaving to activate EMS. Check for the presence of any breathing. Even gasping or irregular breathing is usually adequate for a child. The depth of compressions is changed and the volume of air given is reduced. Use 1 or 2 hands for chest compressions. Assess for response. Tap and shout at the victim.
Hey, you okay?
If you're alone with an unresponsive child, shout for help and begin the ABCDs. Anytime there is a bystander, send them to call 911. Get the AED and come back to assist.
You, go call 911, get the AED, and hurry back.
Open the airway. Check for the presence of any breathing for 5 to 10 seconds. If the victim is not breathing, give 2 rescue breaths for 1 second each, just enough air for the chest to rise. Be careful not to overventilate. Check the pulse for 5 to 10 seconds. Begin compressions if there is no definite pulse or if the pulse is less than 60 beats per minute. Use 1 or 2 hands for compressions on a child. For one-handed compressions on a small child, place the heel of one hand between the nipples. With the other hand, apply slight pressure on the forehead to maintain an open airway.
1, 2, 3, 4.
Compress the chest
5,
30
6,
times to a depth of 1/3 to
9,
1/2
10,
the child's
11,
chest.
12,
Maintain a rate of
14,
100
15,
compressions
16,
per minute.
17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
After 30 compressions, give 2 breaths and resume compressions.
One, two, three.
You should be able to complete 5 cycles of 30 compressions to 2 breaths in about 2 minutes. Call 911 if not previously contacted, then continue CPR. Now, it's your turn to practice child CPR.